Here's another model that we have, and you can see this is the penis here. Turn it sideways. And this is the glans penis, the head of the penis. This is the male copulatory organ. Now this one's been circumcised because there's not a prepuce or a foreskin covering this. You can see what's left of it right here, this little ring, but it was removed during circumcision. Now this cutaneous pouch out here that houses the testes, this is called the scrotum. And you can see inside is the testicle. Okay, the testicle is covered with a connective tissue, which we'll talk about in just a little bit, what that's called, tunica albuginea. This highly coiled tubule on the back of the testicle, of each testicle, is called the epididymis. And leaving that epididymis, you can partially see it right there, is the ductus deferens. Well, looking at everything right here, you see testicular arteries and veins. You have the ductus deferens. You have things you can't see, the autonomic nerves and lymphatics. And then covering all of this, you can see on this side of the model, is the cremaster muscle. All those make up the spermatic cord. The ductus deferens, testicular arteries, testicular veins, the lymphatics, autonomic nerves, and the cremaster muscle make up the spermatic cord. So you can see the cord here is all covered. All this is covered up by the muscle. That used to be part of the internal oblique. But when the testes went down through the floor of the abdomen of the male, it took the muscle with it, and it covers it. Now, when we take this off, you can see that there are 3 cylinders. The top 2 cylinders are called the corpus cavernosa. These are cavernous bodies, and they fill with blood during an erection. The bottom cylinder down here is called the corpus spongiosum, and you can see that urethra right in the middle of it. Like on this one here, I just took it off. Here are the 2 corpus cavernosa on top. Here's the corpus spongiosum with the urethra in the middle. When you take this apart, wiggle it apart, there you go. You can see, here's the corpus spongiosum. See, the urethra's in the middle of it. So this purple is the corpus spongiosum, and that's the spongy urethra. There's the navicular fossa, external urethral orifice. This represents one of the 2 corpus cavernosa. See, there's 2 of them. There's one on each side. And when it goes together, again, see, there's the 2 top cylinders, the 2 corpora cavernosa, and there's the corpus spongiosum. Well, let's look a little bit on the inside here. Let's take this apart a little bit. Here is the ductus deferens coming around the back of this urinary bladder. And there's a seminal vesicle. This one's opened over here so you can see it. The ductus deferens swells. That's called the ampulla of the ductus deferens. It's right here too. It's going to join a vessel called the seminal vesicle. And we'll talk about the fluids from each of these vesicles in just a little bit. Here's the prostate gland. So let's take it apart here. And you can see that here's the ejaculatory duct. They just don't show it long here. They just show a piece of it there. The ejaculatory duct coming into this urethra, going through the middle of the prostate. So that's the prostatic urethra. Well, there is a sphincter up here. They don't really delineate it very well, but this is going to be the internal urethral sphincter. And then here's the floor of the pelvis here. So in that diaphragm, there's going to be an external urethral sphincter, which is skeletal muscle. That's the one that you learn to control for urinating. Here comes after it leaves the prostatic, it's going to be the spongy urethra. Here's the corpus spongiosum. Well, there's another gland that secretes fluids as part of semen. It's called the bulbourethral gland. So that's it right there, the bulbourethral gland. And so it's going to secrete secretions in here too. So there's a spongy urethra like I showed you a minute ago. And if I were to take this back apart, a second, and you put it on like this. See? Now you can see how the spongy urethra goes to the corpus spongiosum. There's the navicular fossa, external urethral orifice. This is one of the two corpus cavernosa on top. These are the ones that fill with blood for an erection. The corpus spongiosum does not fill with blood. If it did, it would close off the urethra, so it doesn't fill with blood.